Around 733 million people faced hunger in 2023, equivalent to 1 in 11 people globally and 1 in 5 in Africa. This is according to the latest State of Food Security and Nutrition in the World report published July 24, 2024 by 5 United Nations specialized agencies. The report shows that the world has been set back 15 years, with levels of undernourishment comparable to those in 2008 to 2009. But even as the percentage of the population facing hunger continues to rise in Africa, it remains stable in Asia and shows progress in Latin America. The report submits that if current trends continue, about 582 million people will be chronically undernourished in 2030. Half, again, of them will be in Africa. For some perspective on this, CEO No Hunger Food Bank, Gbadebo Odularu, joins us now on one slot. Thanks for giving us your time. Okay.
Thank you.
Okay, great. I just wanted to be sure you could hear me. Let's start with your view of these latest data being presented. Again, Africa at the bottom. Does it, though, fully capture the state of hunger in the continent? Some say it might not even scratch it.
Yeah, that's right. It doesn't fully capture it because some of these data being collected, the data sets might overlook a number of vulnerable population, which is also very dear to our heart as Non-Hunger Food Bank. So there's still more people chronically undernourished, malnourished, people that have still not been captured in this data set being presented by the 5 United Nations agency. However, I think the data set being presented by these UN agencies and via the reports, the state of food insecurity in the world, annual report by this United Nations agency is one of the best we've got in terms of reporting in reducing hunger. And for Africa specifically, is, as you've seen, that is really, Africa has always been one of the hungriest continents, not just in this year or in recent year or in post-COVID, but even before COVID, for the past decade or so, it's been like that. So this report and the state of food insecurity and hunger in Africa is not really a surprise to someone. And of course, if you look at how socioeconomic situations have unfolded in recent times across African countries, you realize that it's not surprising that hunger has really worsened, not only in Africa and also in the Caribbean.
All right. I wanted to paint us a picture, really. You are in this line of work trying to reduce hunger. Could you maybe share a personal experience or story in your line of work that illustrates the impact of hunger in Africa?
Absolutely. So, as you know, that one of the challenges that contribute to hunger in Africa, whether you talk about the Eastern or Central African region, as well as in West Africa or the Sahelian region, is being conflicts, insurgencies, political upheavals. So they've contributed not only to hunger, but increase in number of internally displaced people. So as Non-Hunger Food Bank, we are targeting the most vulnerable Africans, Nigerians, in order to help them to alleviate the problem of hunger. And we've seen 4 times the number of IDPs, internally displaced people, on the different IDP camps that we service, that are beneficiaries to the program that we implement. So as Non-Hunger Food Bank, we have a program that is called Temporary Food Assistance Program. And the whole essence of Non-Hunger Food Bank as an organization and the products that we offer is to help alleviate hunger among the last mile, the really, really, really hungry people, because the problem of access, is really very critical. Okay. If you look at it globally, there should not be any problem of hunger, because globally, in terms of mechanized farming, enough food is being produced to feed everybody, to feed every mouth. But when it comes to access, you realize that there's a lot of food being lost. There's a lot of food being wasted. For the case of Africa, and in our line of work, we know that we rescue food. We rescue food. We look at the food value chain and see how where there are losses, especially on the farms, and we rescue them in order to use them to feed the increasing number of mouths, most vulnerable people in their various camps. Yeah.
Yeah, I was going to ask you about the potential long-term consequences, but I think the more important question here would be how you think hunger intersects with other developmental issues such as education and healthcare, because most of the poor, some people say, might not have the right education to provide for themselves.
That's right. Yeah, so I'll give you examples of Kushingoro IDP camp in Abuja that we serve. So we've got almost 543 girls. I'm now focusing on girls and the governments across African countries to educate the girl child. So No Hunger Food Bank, we've got a program that is called Support the Girl Child Back to School. If you look at the recent report by UNICEF, 4 to 5 times the number before the COVID, 4 or 5 times the number of out-of-school children, especially among girls. It's really alarming. So what No Hunger Food Bank has done for a particular IDP camp in Abuja is to identify families that have got girl children that are not able to go to school because they can't even feed themselves and they can't afford the tuition. So we identify 10 of them, and in collaboration with community members, the IDP leadership, the local education administration, as well as Rotary Club. As it's a community development effort that we are putting in place and deploying to reduce not just hunger, but also touch non-hunger related aspect of the life of the beneficiaries that we serve. So it's really critical.
Some would say that some of these measures are not long-term. You're probably just addressing some of the issues short-term, aside from the education part of it. I want to bring in agriculture in Africa. Smallholder farmers and technology. Is this maybe an area we can begin to, or what kind of work do you think we need to do in this aspect to improve our lot when it comes to providing food and sustenance for the people?
Absolutely. So one of the challenges that we found as a No Hunger Food Bank is the limited adoption of technology along the value chain, which is resulting in huge food loss in African countries. So if you want to compare an effective food system in Africa, in a developed country, and you look at the case of Africa, you see that there's less adoption of technology. For example, mechanized farming, or now even the use of artificial intelligence in order to reduce some tasks that machines or machine related or machine catalyzed processes could help to reduce. So there's need to and one of such example that we are adopting now and we are using is through Glovo. So Glovo or Jumia Food, they are delivery apps. There's also an emerging technology where they serve as a platform where instead of wasting food across the food value chain by restaurant, by kitchen, the food that are meant to be wasted, they are deposited with Glovo or another delivery app. And that food gets back to No Hunger Food Bank, and No Hunger Food Bank make the food available to the most vulnerable member of the population. So there's a need to scale the adoption or catalyze the adoption of technologies across the food value chain in order to help rescue food. Because our role is not just humanitarian or maybe serving as the first responders to provide food to the most vulnerable. No, we also adopting and promoting and fostering the use of climate smart agriculture, as well as community driven or community driven agriculture, that will make farmers to adopt the right technology that will help them reduce food loss.
All right.
Despite the fact that there's hunger,
because I really would want you to continue in that line of thought, but we're time pressed, so I'd like to capture as many areas as we can. I understand you're domiciled here in Nigeria, so you kind of have an idea what is being done.
Yep.
You can confirm whether you do have an idea of what's being done to improve support for smallholder farmers in Nigeria. What is your assessment of how much is being invested in the food chain, in the food value chain in the country?
Yeah, thank you. So I'll still piggyback on the role of technology. Not much has been done in helping to help smallholder farmers to adopt the appropriate technologies that will help them to scale productivity. And that's why you still find a lot of a good testimony to whether so much has been done is when there is a particular season, like tomato season, and you find the price of tomatoes increasing by 50%, or the tomatoes doubling, and beyond the reach of even a middle income earner in Nigeria. Then that's a big problem. That's where we as governments, as non-government organizations, as private sector, we need to work together. Whether it's big producers or big or large scale producers, they need to come together to help and strengthen the capacities of the smallholder farmers to be able to adopt and scale the usage of technology most appropriately in order to regulate and stabilize prices, so that prices will not only respond to when there are seasons. The rate at which the prices are going haywire is unthinkable, especially in this age where we have the appropriate people, the right people at government. There's so much that still needs to be done as far as that is concerned.
What's the role of policy and advocacy in helping to address hunger in Africa? What kind of work do you think we still need to do?
Yeah, so the work we need to do in terms of policy and advocacy cannot be separated from the problem, the challenge itself. For example, for No Hunger Food Bank, we've got 3 pillars which drive the work we do and the products that we offer to our beneficiaries. The pillar of food banking, the pillar of empowerment, which responds to the challenge you talk about, education, and the third pillar that we've got is policy advocacy. So the policy advocacy is to help to develop the evidence-based policies that will help us to bring about a reduction in hunger or stabilize the food systems. The food system currently is, over the years, is still very, very weak. The nodes within the food systems, they are still not connected. Our food system in Africa, across our countries, across our borders, they are still highly interconnected. They are still being operated in silos. So there's a need to a policy, the right policy that will help all the systems, multi-stakeholders, multi-ministerial intervention that will help to all these systems that are related to food, whether it's health, Ministry of Health, Ministry of Agriculture, Ministry of Humanitarian Affairs and Poverty Alleviation. How do they come together at a table and develop a policy that will help to reduce, number one, strengthen the food systems, reduce price fluctuations, make food more available, and also donation policy. That's one other area that is very important. There's no way you have a very efficient food system that there will not be some element of waste or some element of losses. So, but there's a need for a donation policy, but at the national level, at the parliamentarian level, that will help grocery stores, shopping malls, farming organizations to see how they can donate the excesses that could have been wasted to non-government organizations and also other orphanage homes that will make them available to the less privileged and most vulnerable Nigerians. So a food system that looks at all those nodes is really very critical in this post-COVID age for Nigeria and for other African countries.
Let's talk about the part about the vulnerable, and that's about inclusivity and equitability. How can we ensure that hunger reduction initiatives are not only inclusive but equitable?
In terms of the equity, which is very good question, we need the data sets that will help us to be able to capture and measure and also impact equity. So as non-governmental bank, we're not just going to embark on outreach program. Like I told you, we've got a program that we call Temporary Food Assistance Program, which is based on the data we've collected in the field. So we non-governmental bank is on Kushingoro, we have Durumi, we have Karumajiji. So all the IDP camps that we operate in, as well as in other northern Nigerian countries that we operate in, we have the data set that helps us to inform the kind of product that we make available to them. And in such, we put in place our equity lens or equity goggle to ensure that we, most importantly, especially children, children under 5 years old.
So how can we do this at a national scale, this inclusivity? You have a model with the design that you have. Speak on a larger scale, how this can be maybe replicated at the national level.
Yes. So of course, the replication would, as you rightly asked, it would be scaling the proven and successful cases at the community level. Another intervention that will make it work is what the government is currently doing. How to bring in more people into the bankable system. There's currently, as you rightly said, the vulnerable people, they are currently not within the formal system. How does the government want to put in place structures that will help the vulnerable, the IDPs, to have their own BVN, have information about all of them? Of course, the United Nations may have some, because some of the information is being captured by the UN system. But at the national level, we also need that data set to inform how we put in place equity in addressing the problem of hunger and nutrition insecurity among this vulnerable group of Nigerians and Africans.
Gbadebo, we'll have to leave it here. Thank you so much for speaking with us.
Thank you. Thank you for the opportunity.